it's Kelly, the nurse practitioner at The Wellness Way. I'm here to talk to you today a little bit about autoimmune disease, the natural approach to minimizing those symptoms or putting autoimmune disease in remission. So, why do we want to talk about autoimmune disease? Personally, I'm talking about it because it's affected me too. I have rheumatoid arthritis and I also have Hashimoto's thyroiditis, and I'm doing everything I can to control my symptoms, to heal my body, and reduce the need for any medications. And I want to give you some of that information too, so you can benefit from what I already have learned and benefited from. So I made dramatic changes to my life that made improvements to my symptoms on a daily basis. Nobody ever told me about some of the simple things that I could do in a daily routine, the things that I am eating that were actually causing inflammation in my body, making my feet swell and my hands swell and my joints hurt. I was taking ibuprofen 3 times a day along with the other rheumatoid arthritis medication I was on to control my symptoms. And whenever I was sitting for any prolonged period of time, man, was I stiff when I would get up. I'm too young for that. I was diagnosed at the age of 33, and I had been having severe symptoms probably for 4 to 6 months prior to finally being diagnosed. What's going on? What is it really? Why at the age of 33 was I having difficulty moving after sitting down for a period of time? Not normal. I can tell you I was on medication for rheumatoid arthritis for 8 years before I learned some new things to change my life and to get myself off of those medications while still controlling my symptoms, and actually controlling my symptoms better than they ever were controlled before while on an immune modulating medication and on constant nonsteroidals, okay? I now have a passion to share all of that information with you because I want you to feel better too. So we have to talk about what an autoimmune disease is so that we can start to heal it and understand it. It's caused when the immune system actually loses its ability to differentiate between proteins of our own body and proteins of foreign invaders. So the body actually attacks itself. When you have Hashimoto's, your body attacks its own thyroid. It starts to destroy it. And if too much is destroyed, you'll always need thyroid medication because the thyroid that's left can't produce enough of the hormone. And we need that in our body on a daily basis. So we need to stop the destruction. We need to stop the hurt. We need to tell our bodies, stop beating me up. I can't take it anymore. So the body attacks itself. What I've learned through some literature review is that about 1/3 of your risk for developing an autoimmune disease is from genetics. But that leaves 2/3. A bigger portion is actually related to our diet, our lifestyle, having previous infections or having a chronic infection, and then also our exposure to toxins, extra hormones or hormone imbalances, and unrelieved stress. Your body can't handle being under constant stress. So the gut and the immune system, how does that work? About 70 to 80% of your immune system is actually in your gut. Your gut protects you from some of those bad proteins, those bad toxins, those bad environmental conditions from getting into your body, into your bloodstream, and wreaking havoc. Your GI system has about 70 to 80% of the immune system, okay? It has to be healthy to prevent you from getting infections. When it's not, we have problems. Some examples of when it's not healthy is when there's too much bad bacteria, when we have viruses running around, when there's extra fungi or yeast in our system. Maybe there's a parasite in there that's destroying the GI tract or damaging it enough to let those other toxins and bad things into your system, which lead to some of the symptoms that you're having. Offending foods like allergens and irritations can disrupt your GI tract as well. Do you know if you have any food allergies? And I'm not just talking about eating an apple and your lips puffing up and having an acute reaction. I'm actually talking about allergies that are much more delayed, that you may eat that apple and not know that it's causing you distress or a problem or breaking down your belly because you're not sensitive enough or able to recognize that it gives you bloating or gas or changes the bowel movements or that it's contributing to your joint pain, or that it's contributing to the destruction going on with your thyroid. It's hard to tell because those delayed reactions stay in your body. They have a half-life of about 20 days. So how can I eat a food today and it give me a symptom on day 10 and be able to relate that? I don't think I can do that. There are ways to help figure out some things. There's an elimination diet, which you can get rid of things that we know cause inflammation. You can get rid of things that we know are bad for people that have autoimmune disease and slowly add them back in once you're feeling good and see if any make you feel bad. That's a lot of work, and that is a good thing to do, but we can also test for that. We can just test your blood and see what foods react in your bloodstream. When we have an imbalance of the normal gut flora, that's what breaks down your gut and your bowels and lets bad things leak in. We talked a little bit already about bacteria, yeast, and parasite infections. Need to find out if any of that is going on, and we test that by testing the stool. And we can see that, and then we can treat it, get rid of it so that the gut can heal. The body then can heal, repair itself, and we won't be continually leaking in all of those allergens or toxins and chemicals. Poor diet, lots of alcohol, lots of stress, as well as some medications can also break down the GI tract. But there is ways to heal. There are ways to heal. You can create ways to heal your body. You just have to know how to do it and be willing to do it. So you have to remove the foods that are contributing to that leaky gut. All those things I was just talking about that damage the gut, the yeast, the bacteria, the toxins that break down that system, that's also called leaky gut. So the lining of the GI tract is supposed to be nice and tight. It protects us. But when there's been damage, it starts to get little holes or little leaks or little gaps. So then partially digested food can leak through, and that gets into your bloodstream. There is not supposed to be partially digested food in your bloodstream. The body thinks that's a foreign invader, which it is, and it attacks it, and it starts that destruction process. So we have to heal that leaky gut if you ever really want to get better. We need to balance the good bacteria and the bad bacteria. We need to balance out our hormones, and that does also mean reducing stress, because when we're under high stress, our body's always in that fight or flight. It always feels like it's fighting someone or something, and it's in a heightened state, and there's extra hormones and there's extra steroids. And for a temporary period of time, we need that. That's a protection mechanism of the body. But for a long period of time, the body can't sustain hormone levels like that up this high, and it wreaks havoc, and it destroys the organs in your body, and it depletes hormones that are needed for other things in your body as well. We need to avoid inflammatory foods, and we'll talk about that a little bit more as well. You need to focus on eating nutrient-dense foods, good foods, whole foods, actually real food, not food out of a box, because if you read the ingredient list, when you don't recognize some of the names on the ingredient list, that means it's not real food, okay? We have to support your gut health. We need to restore nutrients in your body because we're not absorbing them or they're being depleted because of the damage in there. We need to provide the body with building blocks that it needs to heal. All of this is coming through nutrient-dense foods. We need to resolve the inflammation in our body. Thyroiditis has inflammation. Rheumatoid arthritis, if you have that, you know you have chronic inflammation. Avoiding some of these things will just decrease that inflammation, and you won't need as much pain medicine because there's not as much pain going on when the inflammation resolves. That should be our goal. Resolve the inflammation, not just suppress the immune system. We need to heal the immune system in the gut. We need to heal it, not just tell it, stop working like that. Okay? I hope that makes sense. We need to create the environment for healing. Doing some of these things is really not a cure. If you've been diagnosed, you'll always have that diagnosis, but it can lead you into remission. And remission is wonderful. It means you're not having those daily symptoms. Okay? Our goal is to get it into remission and keep it into remission. If we restore the body's normal function, it's not a cure for autoimmune disease, but it can send it into remission. You can stop your body from attacking itself. Did you know that? If you have thyroiditis, I bet you have had your autoantibodies tested for Hashimoto's to give you that diagnosis. So you know you have antibodies. What do? Those are the things that are responsible for attacking your thyroid. But did you know you can stop them? You can get them out of your system. You can get them down. I was never told that in the beginning. It was tested. I was given the diagnosis, but no one did anything about it. I'm working really hard to get all of those antibodies that keep attacking my thyroid to get them out of my system. Have you ever heard of the SAD diet? I'm sure many of you know of lots and lots of different diets. You've been on some of them, you've heard about some of them, think some of them are good or some of them are bad. Do you know the SAD one? I bet you do. You just didn't recognize it as being called SAD. Standard American Diet is a SAD diet because it's high or rich in energy and calories, but it's really poor in giving you any nutrients. That's what needs to change. Once you start changing your diet, you can change how your disease affects your body. So there's something called the Autoimmune protocol, and there's lots of different resources out there if you look it up on the internet and do some research on the Autoimmune protocol, but it gives you a lot of good information. Some of them are slightly different than the others. If you just jump in to do the Autoimmune protocol, it might be a little bit overwhelming. There are a lot of things to avoid, and that can be hard. That's a hard place to start. It's very strict, and the stricter you follow it, the better the results will be. So understand that, but it doesn't mean you have to start there. You need to start somewhere. An elimination diet, I mentioned already. It can help get rid of some of those foods that are triggers for your immune system and for your inflammation. We'll talk a little bit more about that. But you don't have to follow those things right away. What you need to do is just get started. I'll tell you where I started. I started by eliminating the top 4 things that are inflammatory to my body. And this made a big difference. I got rid of gluten. I got rid of corn. I got rid of soy. And I got rid of dairy. Those were the 4 things that I started with. And it really decreased my inflammation. I was able to decrease the amount of ibuprofen I was taking on a daily basis. Within about 2 to 4 weeks, I wasn't taking as much ibuprofen. Could I tell a big difference in how I felt? No, until I realized I wasn't needing the ibuprofen. That was the big difference. I wasn't needing constant inflammation reducers, pain relievers, because the inflammation was going down in my body. Now, if that still sounds too much to do all at once, start with gluten. I want you to start with gluten. Even that can seem overwhelming for some people. All you got to do is get started. You have to try. And it's okay if it's not perfect. It's okay if you're not perfect at it. And if some things sneak in that you had no idea. But go into it with good intention and cut the gluten out of your diet, and it will make a big impact on your disease. Once you get that under control, then you can look at some of those other things. Then maybe add dairy and corn and soy. Then maybe look at the elimination diet. And then maybe you're ready for the true autoimmune protocol. Food is medicine, and you can heal your body from within. So don't get trapped in the world of surviving only on medications and getting into that downward spiral. Do whatever you can to help control that. I'm not saying that some of you won't still need medications, because you might. But what I am saying is that these are things, the food that you eat is contributing to the symptoms that you have. So if you can do something to decrease your symptoms, don't you want to try it? I know you can do it because there have been many, many people who have. So get started today, look up what foods have gluten in it, and start to eliminate that from your diet. Good luck, and let me know how you do.